Hello students, welcome to VHS e-classes, and today we are going to discuss a very important topic in nursing research, that is non-experimental research design. In a previous lectures we have discussed about the experimental designs or approaches. Now here we'll talk about the non-experimental designs. So what exactly the non-experimental designs are? These are the approaches that do not involve any manipulation of the variable. That is a one important point. Means they are basically designed in such a way where we make an observation. We make observation of the variables. We make observation of the relationship that exists among the variables. Okay. So instead they focus on the observing and describing the relationship, okay, between the variable, and we never try to create an artificial situation to observe the or to alter the effect on the outcome variables. Okay. So if I give an example here, I can say when you are going to conduct any prevalence study where you want to see what is the prevalence of tuberculosis in a particular area, what you do, you go and observe the people, you ask their their status, whether they have the tuberculosis or not, from various sources, and finally you just simply calculate that among the total population, how many people are having a specific disease or a tuberculosis. So this is merely a description. Similarly, in another example, if you see, if just I want to see is there any relationship between the height of father and son, simply I may collect the data from the father and son, and then I try to correlate with that. In both of these situations, you will see we have just observing what exists. For this reason, these non-experimental research designs are also known as a observational designs or ex post facto design. Let's talk about some of the important features of these designs. So I'll talk about the three important characteristics of non-experimental researches. First is observation, second is they focus on relationship, and they are conducted in a natural setting. So they are making observation of the variables as they occur in a natural setting. Second is the focus on the relationship without any manipulations. So like if I just consider my previous example where I say I want to see the relationship among the height of father and height of son. So I'm not going to manipulate any of such variable, but what I'm doing, I'm just observing the correlation, the relationship among these variables. Okay, so that is about that. And remember, such designs are never intended to determine any causality. So observational researches, or what I say non-experimental designs, are never intended to determine the cause and effect relationship. As in case of experimental researches, we have seen that we are always intended and we have a purpose to determine the cause and effect relationship. Like for example, if I want to introduce a new medicine to the group of patients and I want to see its effect on a patient recovery. So this is an example of a causal relationship, cause and effect. Medicine, that is an independent variable, is a cause, and outcome, that is a recovery of a person, that is a dependent variable. But such focus is not there with the non-experimental research. Though in non-experimental research we try to build the correlation or relationship among variables, but without manipulation. Please remember that. Then third important point is a natural setting. So non-experimental researchers are conducting studies in a real world, okay, real world environment with a high authenticity. So if whatever I want to study, whether I want to describe something or want to explore something or determine the cause and effect relationship, my research setting would be a natural, means I will conduct or collect the data from the subject in their own milieu, in their own setting. So these are the three important features, please remember. Next important point here is a types of non-experimental researches. Okay, so it is not exclusively I am talking here about the types, but I have tried to define the non-experimental designs based on their number of variables that get involved as descriptive designs. In that we have univariate, exploratory and comparative. Okay, then based on the relationship or when the data is being collected, we call it as a correlational designs. In that we have prospective and retrospective, we have a cross-sectional versus longitudinal, and we have a case control versus cohort designs. and there is another category that is the other designs. In that we can put the survey method and the methodological designs. So this is not an exclusive classification. If you refer some other books, they may have a different classification of that, but more or less non-experimental designs are categorized on these bases. Okay, so we'll talk all these one by one in detail. First we'll talk about the descriptive studies. So what do you mean by descriptive studies? So descriptive studies always try to describe the characteristics of population of interest or phenomena being studied. Like the example which I have given, I just wanted to know the prevalence of tuberculosis in a particular municipal area. So that is, I want to describe that. Or maybe all the prevalence or incidence researches that you do, all the kind of surveys, okay, usually have this purpose of description. So it does not answer the question how, when and why. Rather, it always addresses the what of the phenomena, what exists. Like for example, how many students remain absent from the classes on an average in a particular school or a college. So what exists? Okay, they talk about that. The question is that what are the characteristics of the population or situation being studied? Okay, so descriptive studies provide the base for the hypothesis generation. That is another, because once we know what exists, then only we can predict that. Okay, that prediction is called as a hypothesis. Okay, so they are the base for generating the hypothesis. Once you identify what exists, like for example, if you see the prevalence of students, okay, those who are absent from the college. So now you with that research you will say that most of the students of a specific characteristics are absent from the classes. Maybe they are one who come from distance. They are the one who have a poor academic performance. Now, based on this what we identified, now we can build the hypothesis. Like we can say the students, those who are staying away or distance from the college, more likely to remain absent from the classes. So like that you can generate the hypothesis based on that. Now when you talk about the types of descriptive designs, so univariate, so name itself says it's univariate designs are the simplest form of observational research. Uni means one, okay, and so when you talk about the one variable, okay, that's the literal meaning of that, but it is not the case. Univariate means a simple researches, okay, simple descriptive researches where primary purpose is to describe, it collect the data, summarize the data and find the pattern in the data. Okay, like for example, you observe the characteristics of the student, those who are absent from the classes, and then you identify the pattern, who are more likely to remain absent from the classes. So here two examples I have given here. One is a prevalence study and then is a incidence study. These both are the example of univariate descriptive studies. So how do we calculate prevalence studies? That is the one. What is a prevalence? Prevalence is the number of cases of a condition at a particular point in time, okay, divided by the total population that affected with that, okay. So and multiply with the k. K could be your 100 or maybe it's 1,000 or whatever. So that is about this. Like for example, you want to see the prevalence of tuberculosis in that area. So just you can suppose there is a population of 10,000, okay, and out of that you found there is a 80 people having a tuberculosis, and that start from the 1st April to I say 31st March. Okay, so these are the people. So for the last 1 year, you collected data about the patients who's having this. So that means 80, your 80 divided your 1,000, okay, and multiply your denominator, let's say from 100, you will get a percentage of that. So it's very simple, you can calculate the prevalence. Then second study here is an incidence study. Incidence is the number of new cases or a condition over a specific period of time. Okay, like if I consider the same example here, if I say there were 80 people from April to April, now from last 1st April, there were 20 new cases. okay, and 1st April to 31st March of the next year. So that 20, and then the number of population at risk. How many people are risk of developing tuberculosis? Let's say, again, I say 1000 people or 10,000 people, then multiply by your K. K could be 100 or 1000. So that is the incidence. So incidence means number of new cases in a specified time period. Prevalence means number of cases, old or new, exist at the time of data collection. Now for the prevalence study, if you just see, there are two types. There is a two type of prevalence. One is a point prevalence and then the interval prevalence. What is a point prevalence? Point prevalence is something where you just identify the number of cases at one particular point of time. Like for example, once you had a survey and with that you identify how many peoples. Then when you say interval prevalence, that means you follow the specific time period. Like for example, if I say 1st April to 31st March. So in that specific period, number of people having that particular problem. When you talk about the methods of descriptive researches, so or what we say observational methods. So there are two basic methods we can use to conduct the observation, this particular type of research. One is survey method and the case study method. Case study method is something where we conduct the in-depth, okay, data from the subject. So usually the case study will deal with a less number of samples as compared to the survey. Survey we are going to discuss in detail as a method. So that's about the univariate. Next type is what we call a exploratory research. The second type in this category, in a descriptive category, if you see, as I told you here, univariate, exploratory and comparative. Okay, so second I'll go with the exploratory. So if you remember, while discussing the purpose of a research, I told you the research has a many purpose. One purpose was to describe. So description can be, explained with a one word, that is what exists. Whereas when you talk about the exploratory research, it is something to explore in detail. So an exploratory research design is used to investigate a research problem where there are few or no earlier studies being done. So of course, whenever you conduct the exploratory research, we should have one purpose, that certain phenomena or concepts are not discovered or not studied in detail, and we wanted to know more about that. Okay, so that to have a deeper understanding of that particular topic, to identify the key variables and to develop the hypothesis, okay, we conduct the exploratory research. So in simple term, I can say these are interpretive researches, as it answered the questions such as what, why and how. Now, your descriptive research only answer what exists. Like for example, if I say those who are having a poor academic performance more likely to remain absent from the classes, that is a descriptive research. But descriptive researches never answer why. If you want to answer why they are more likely to remain absent, then you conduct exploratory research. Like for example, if I say number of people having a non-compliant to a psychotropic medication, so I can say 100 people were prescribed the medication, and out of that, let's assume that maybe the 18 people are not following the instruction. So I say it's a 18% prevalence. So that is a descriptive. But why this happens, why people non-compliant, who they are, what are the factors that affecting non-compliance, okay, all these are the area of exploratory research. So if you look at the characteristics of exploratory research, they are unstructured, they are partially structured or loosely structured, semi-structured I can say, because whenever you want to study a phenomena or a concept for that little is known, you cannot be very much sure, you cannot have very structured plan or method, okay. So interactive and open-ended, usually the questioning or method of data collection is open-ended, okay. If you want to explore more about something, okay, so you should always frame the questions based on the need, okay. So it's usually open-ended. They concern with the what, why and how the phenomena or the problem is, which already I explained you, and they are usually done for the phenomena. For that there is no prior research. and they are in-depth, okay, as compared to descriptive, they are in-depth. They are flexible because we have to make modification as required. Like for example, if you decided the data collection to be done in 10 days, it may take more or less time of that, okay. They are broad, they're scattered, okay. So basically, you always have a broader framework to conduct that. You are very flexible in changing your research methods, your data collection techniques, your tools, okay. So that is the characteristics. Then yeah, there is a considerable confusion among people about exploratory research, and sometimes they say whether exploratory research is a quantitative or qualitative. The answer is both. It depends. If your data collection level of measurement or your level of measurement of data collection is quantitative, means if you're collecting the information which can be described numerically in numbers, then it is a quantitative exploratory research. Like for example, you wanted to know the prevalence and factors affecting that, and you identify various factors affecting non-compliance, and now you are categorizing which is the most important factor to least important factor, okay. So that kind of research could be an example of quantitative exploratory research. Whereas if your data is being collected qualitatively, I just wanted to explore about the lived experiences of people after retirement, then this exploration become a qualitative approach, okay. So please understand that. So exploratory is a, it is a classification based on the purpose, how in depth you are conducting a research or an inquiry, okay. So based on that, it is exploratory, qualitative as well as the quantitative. Next important design in this category is a comparative study, okay, comparative study. So comparative studies in non-experimental research design is used to compare two or more group or variable, again without manipulation. That already we know that in non-experimental researches we never do any manipulation. So what we do here is, in this comparison, what we do, we compare, okay. So comparative study identify the similarity and differences or insight among the things. Whereas other methods, what they do, they always identify what exists, why it is, how it is, okay. Then who is more than who, okay. When you do that kind of research, then we call it a comparative, okay. Now that kind of comparison among variables or among group, like for example, I just want to compare the attitude of students, okay, based on their gender. I want to study the attitude of nursing students towards nursing profession based on gender. So I can take a two group, male and female nursing students, and this I can compare what kind of attitude they have, and is there any difference among the attitude of male and female nursing students. The primary goal is to observe and compare the outcome or characteristics in a different groups, uncover the pattern or association, okay. That's the main purpose which already I told you, okay. So these studies are basically, they're useful when manipulation is not possible, okay. Like as we know, in many interventional researches, ethically it is very difficult to conduct such manipulations. If I give an example, like suppose you want to see the effect of cigarette smoking on health outcome, okay, on a health status of somebody. So what best possible research you can do for this? If you conduct experiment in this situation, what you need to do, you need to take a group of people and then you divide them in a two group, where one group would be asked to smoke the cigarettes for a period of time, and that group would be compared in future with another group. So ethically it is not possible. We cannot ask somebody to smoke, okay, just to see the effect of it, okay. So what we can do, we can just have a group of people, we can ask them, we can categorize them, those who are naturally smoker means they are already smoker, versus we can compare them with a group which is not smoker, okay. So smoker and non-smoker we can be compared. So that kind of research is a basically comparative research, okay, that can be done. So various kind of there is a one more thing about this comparative study before I proceed. Except the comparative and correlational design, all the studies, all the non-experimental researches do not frame the hypothesis. I am repeating this again. Except the comparative and correlational design, non-experimental research do not require any hypothesis, okay. Now If you talk about the characteristics of comparative studies, so it involve more than one variable. Okay, so minimum two variable would be there. Okay, like for example, two or more variables. Like for example, if I say smoking and health, or maybe if it is not variable, then groups. I maybe see urban and rural, male versus female. So all that can be the part of that. Then involve making comparison. We always compare. We always make comparison among the variables. Like as you can say, I want to compare smoker versus non-smoker, or I just want to compare the effect of smoking on the health. There is no manipulation of the variables as like experiment, which already I told you. It involves hypothesis testing, which I told you. There will be a prediction. Like for example, when you're comparing the health status of smoker and non-smoker, you will have one prediction of that, okay, and which you're going to test. I can say those who smoke more are more likely to have health related issues as compared to those who do not smoke. So that kind of predictions will guide my research. And use bivariate statistics. Descriptive researches or exploratory researches primarily deal with the univariate analysis, where the one-to-one analysis of the variable is being done. Whereas for comparative studies, we use a bivariate analysis. Okay, so maybe the correlation or maybe t-test, that kind of analysis we do with that. So that is about the comparative research. So next we are going to talk about the correlational designs. Okay, so another important category of research design under non-experimental category is a correlational studies. So already I have told you what is correlation and what exactly the meaning of that. So in a simple term, I say when you want to determine the bond of relationship among variables, okay, like variable x or variable y, and what relation exists among these variables. I mean whether changes in the value of one variable makes the changes in the value of another variable. If answer is yes, then we call it a correlation. So whenever you are intended to check or evaluate the functional relationship among variables, we use correlational researches, and such relation is known as a correlation. Okay, as you can see here, a correlation indicates the extent to which one variable, that is x, like for example, let's say height, is related to the another variable, that is a weight. Okay, as x increases, if someone's height increases, does y increases? That weight also increases or decreases. Okay, so on the basis of that, we can have a positive correlation. Like for example, if height increases, weight also increases. If both the variables are moving in the same direction, we call it a positive correlation. Then if you increase one variable, then another variable will decrease. Or if you decrease one variable, another variable will increase. Means if both the variables are moving in opposite direction, then we call it a negative correlation. Okay, like for example, you can say if stress increases, what happens? Your coping mechanism comes down, your coping ability will reduce. Okay, when you do more workout, what happens? Your body weight will come down. Okay, so that kind of relationship is a negative correlation. And there is also called as zero correlation. Means if you increase the value of one variable, it will not make any constant changes in the value of another variable. Okay, so like example already I have given, the beauty and performance in the examination. So such relationship is known as a zero correlation. Okay, so which already I told you, positive correlation, negative correlation, zero correlation. So please remember, positive means when both the variables are moving in the same direction. Negative correlation when both the variables are moving in opposite direction. And zero correlation when there is no constant change in the value of two variables. Now we'll talk about what are the types of correlational researches. Okay, so this is a very important figure here I am showing you. So based on past, present and future. Okay, means what you are going to study when you are going to study the variables. Like for example, if you are studying something that in present situation, like for example, I just wanted to know number of students remain absent from the classes as today, then that kind of researches are known as a cross-sectional studies, where the variables are being evaluated or observed in present time. Okay, then there is another type of study, that is a prospective study or prospective cohort study. I'll just focus on the point. Prospective means futuristic. You see the variable impact in future. Okay, that we call a prospective cohort. Like for example, somebody is doing smoking, and what will be the impact of smoking on health? Today the person is healthy, but what will happen after 5 years to a person? So when you conduct that kind of research where the outcome is a futuristic, this is all about outcome variable, okay? When your outcome variable you observed in the present, we call it a cross-sectional. When you observe your outcome in a future, then we call it a prospective. When you observe your outcome that was already done in the past, like for example, recently there was a result from the university, and let's say out of 60, 20 students got failed in a specific paper. Now already outcome is there, they failed. Now I'll go retro, I'll go backward and try to find out why these students failed in the specific examination. So when outcome is being observed in the past, that we call a retrospective cohort study, okay, or retrospective study. Similarly, we have a case control study. What is a case control? It's a retrospective only, where you have a specific case. Like for example, you found that 100 people with a cancer, okay, so and then 100 people of the same age that do not have a cancer, no cancer. So these people, those who diagnosed with a cancer, are known as a cases, and these are the control. Now I wanted to know why these people develop cancer. I always compare the people who develop a cancer from the people of same age or same geographical locality or similar characteristics are being observed or compared with those who develop the cancer. So that is a case control, but case control is also kind of a retrospective researches, okay. So here please understand, if your outcome variable you measure in a present, it is a cross-sectional. If you measure the outcome in future, that will happen. Like for example, if you want to observe, okay, let me see what happens if someone keep on smoking, as example, same example, okay. And retrospective means outcome is a past oriented. So let's discuss about these designs in detail. So first is a prospective correlational design. So in this study, researcher relate present to the future. You relate present to the future, okay. So normally we say like such studies start with the presumed cause, okay, and then observe the presumed effect in future. Like for example, if I say here smoking, okay, and this smoking definitely or smoking may lead to a health issues, okay. So this is smoking is not a cause, it is a presumed cause. I assume that the smoking may have a adverse effect on health. So that kind of researches are known as a prospective research. So what we do here, the subjects are followed into the future in order to record the development of any of the outcome of interest. So suppose I have taken a group of 100 or 200 people, okay, those who are smokers, and maybe they are healthy right now, and I'll just observe them for next 5-10 years, okay, or a specific period of time to see its impact, okay. So that is a futuristic study of prospective, and for that reason there is a follow period is required. Usually the prospective correlational designs take a longer time, because outcome is a futuristic, it may not come in a day. So you have to observe. Like for example, we see what is the impact of obesity if somebody is taking a specific kind of a diet, like somebody is taking all high calorie foods or unhealthy food, what would be the impact of that? So the impact will not happen in a day. So we have to observe such group of people for over a period of time. That is a prospective designs. So these are some of the important features here. One is they move from cause to effect. Okay, cause to effect. Effect is a futuristic. They try to link their present to the future. Often longitudinal, but can be cross-sectional. What is longitudinal? Means they are the researches where we observe the same subject over a period of time. Longitudinal means something that runs for a longer time. See, there is a term cross-sectional. Cross-sectional means just taking a one picture. What is a longitudinal? It's about making a full recording. Okay, it's a full video. So longitudinal means something that runs for a longer period of time. Please remember that. Then we have a hypothesis testing. All the correlational designs are, governed or guided by the hypothesis testing. And there is a follow period, because now I have taken a group of people who is having a specific high calorie diet or taking unhealthy diet. So I have to observe them for a period of time. So that period is called as a follow-up. So maybe I'm observing them every 6 months. I'm following them for a year or 2 years. That's a follow-up. So these are the important features of prospective design. If you can see the example here, a study examined the lung cancer incidence among the smoker and non-smoker. Researchers followed both groups for several years, collecting data on lifestyle, exposure and health. Then they compared the lung cancer rates, highlighting the potential link between the smoking and the non-smoking. Okay, so that is the point. Please understand that. So this is how we can conduct the prospective researches. Now, let's move on the second type of correlational design, that is a retrospective correlational design. So in retrospective design, the outcome variable is a past oriented, means outcome is already there. In a previous prospective design, what we have seen, in a prospective, outcome will be futuristic. A person is a smoker, but he has not developed any health issues. It may develop in future. But in retrospective, what we do in retrospective study, we look backward and examine the cause in relation to the outcome that is established at the start of the study. Okay, in this study, the outcome have already occurred, okay, before the investigator initiate the study. So subjects based on their exposure status are compared with their incidence of the disease. Okay, and this is how we are going to do that. So what exactly they are trying to say? They are trying to say, you consider the let's consider the same example. Suppose you have visited a hospital and you visited a hospital where you identified the 100 people diagnosed with a cancer. Okay, and now what you do? Outcome. This is a cancer is an outcome, no? Now you collected their history. Okay, you ask them about their smoking history, their lifestyle related things, their family history of having cancer, their age or other all risk factors which you feel could be a presumed cause for this outcome. And now, once you collect the complete data, you try to relate that data with the prevalence of that outcome. Okay, and that kind of researches are known as a retrospective researches. If you talk about the research example here, this is a very beautiful example given here. A retrospective study on COVID-19 complication could analyze the medical record for the patient previously hospitalized with COVID-19 to identify the common post-infection complications. Okay, researcher would review the past data from the hospital record to assess the complication such as lungs fibrosis, cardiac issues, neurological symptoms, dermatological conditions and mental health conditions. So like, so what you do here, those who are coming with such problems which I have listed here, like cardiac issues, neurological issues and all, then you relate that people with their hospitalization during COVID-19. So you can identify that what characteristics of people, okay, and what specific features which are found to be related with the present condition. Okay, that is a retrospective study. Now, if you want to make comparison between retrospective and prospective, as you can see, retrospective studies, the dependent variable is identified in the present a disease condition, means dependent variable is there, and we try to attempt to determine the independent variable, the cause from the past. So we relate that. Okay, similar example, like if I give us, like student has failed in the examination, now I want to find out the reason for that. Then prospective is always a futuristic. Okay, we just have a presumed cause and then we see the effect. Retrospective studies can never be experimental, whereas prospective study can be experimental as well or non-experimental as well, because they are having a presumed cause. Like if I give example of prospective experimental research, I can say if somebody is being introduced this specific diet, then the patient may have a better health outcome. So this is an example of prospective experimental design. Usually case control cross-sectional in nature. So whenever we conduct the retrospective studies, what we do, we always try to find out the case and control. Already I told you what is case and what is control. Case means those who have that specific outcome, whereas control means a person who had a similar vulnerability to develop that outcome but did not develop. Okay, then usually they are cohort and longitudinal in nature. Okay, so usually we take a group of people with a similar status. Okay, we just, let's say cohort means the people who have a similar characteristics. Like for example, I am taking smoker and non-smoker, but none of them has developed any health issues. Okay, so they are the longitudinal. No means it takes a time. Cost effective with less chances of subject dropouts, because retrospective researches are done with a short period of time. Outcome is already there. You have to just find out the presumed cause for that, and usually we do that by by exploring the data and secondary records and etc. Whereas we talk about prospective studies, they are costly because it go for a longer period of time and the dropouts are very high. Because suppose you have taken 100 people, those who are smoking, and you have to observe them for next 5 or 10 years. So they may drop out from the research, they may change their location, so that subjective mortality is very high with that kind of researches. So that is all about the second type of correlational design, that is a retrospective correlation. We also discussed about the how we can compare retrospective and prospective designs. Next we are going to talk about the third important design, that is a case control design. So which already I have introduced that in this design two groups are selected: the cases, the individual who have the condition or outcome of interest. Let's say the 100 people diagnosed with the cancer, that is a cases, and the control, the individual who do not have the condition. 100 people from the same locality or exhibiting the similar demographic characteristics are known as a control. Okay, or maybe the student, those who failed, let's say 20 students failed in examination, outcome is there, they failed, versus the 40 those who passed. So that failed will be control and those who passed would be the failed would be the case and they will be the control. Okay, researchers look back retrospectively to compare the exposure or risk factor between these groups, helping to identify the possible cause or association. So what we do, once we identify the people with the outcome or people without outcome, and then we compare what exactly has caused this specific outcome. If somebody developed a cancer, what was the risk factor that involved into that, which were lacking in a person having a similar exposure but didn't develop the cancer. Okay, so that kind of thing is a case control designs. Next we'll talk about the another important design here is a cohort design. Okay, so what is a cohort? So cohort is a group of people who share a defining characteristics, typically those who experienced a common event in a selected period, such as birth or like graduation or other things. Now, if I give another example for cohort, anybody who is having a similar characteristic, like for example, all the people who experience COVID-19 are considered cohort of each other. All the people coming from a specific geographical area are the cohort of each other. Okay, all the people who enrolled in a university course on a same day are the cohort. The student those who passed out on the same day from the university is your cohort. So cohort means a group of people who is having a similar characteristics. But remember that they are different from the case and control. How come? How they are different? Case and control are also the group of people having a similar characteristics, but one group had an adverse outcome or one group is different in terms of outcome. Like for example, if I say there are 60 students in a BSc Nursing class, and out of 60, if there are suppose 20 students got a negative, they get failed in the examination. So the 20 become a case and 40 become a control. Okay, so but what is a cohort? All the students in BSc Nursing first year, those who are there in a specific batch are the cohort of each other. Okay, so cohort study usually are the study about incidence, cause and prognosis. Okay, so what exactly the idea behind cohort is? What we do here, we just take a, we observe the group of people for a longer period of time, usually for a longer period of time. We compare maybe their lifestyle and their other things, okay, and we keep on doing follow-up, and after a period of time we evaluate the outcome. Let's say I have identified a group of 100 people. Out of that, the 20 people were the smoker, okay, and these smokers, all these 100 people were observed for next 5 or 10 years. Now after 10 years, what are the health outcomes of these 100 people? And then I'll see what happened to the people, those who were smoker, those who were smoking from last 20 years. Okay, so that kind of study is a cohort study, because events are measured in chronological order, which can be used to distinguish between the cause and effect. And for that reason, because both the groups are similar in almost in everything, and then we observe them. So if you look at this flow chart here, what this is: cohort study the population, okay, disease free at risk. So the entire population is a disease free, like as I said, the people do not have. Then you have a group of people, like for example, let's say there are 100 nurses. I'll take this example: 100 nurses, they do not have any COVID, and out of 100 nurses, how many nurses were posted in the COVID ward? So they were exposed. Let's say 50 nurses were posted in COVID ward, so they were exposed. Out of 50, how many developed the COVID? Let's say the 30 developed the COVID infection, and again the 20 did not develop the COVID infection. Whereas the another group, similar group of 50 nurses, they were not exposed. They were posted in some other wards, not in the COVID ward. But still, COVID was the pandemic. So how many of them developed a COVID? Even though they were not exposed, let's say the 10 women, 10 nurses developed the COVID, and 40 did not develop the COVID. And then we try to analyze it in terms of calculating the odd ratios or some other describing risk. So this is how cohort study work. Okay, so usually the cohort study go for a longer period of time. Now this is the characteristics of case and control and cohort study. If you see that, case control studies are usually but not exclusively retrospective. Usually it is retrospectively, okay, but it is not exclusively, it's always a retrospective. No, it can be prospective as a case and control, okay, case is there. Then cohort study are usually but not exclusively prospective. Usually the cohort studies are prospective in nature, okay. Controls are selected on the basis of not having the outcome. So we have a group of people having the outcome, and then we find the group of people having a similar characteristics do not have the outcome. Yield true incidence rate and relative risk. Basically here we always make comparison among exposed versus non-exposed group, okay, but none of the group having a outcome at the time of starting the study. Outcome is measured before the exposure, outcome is measured after the exposure, okay. So here outcome we always observe before, because outcome is already there, okay. Good for rare outcome diseases, because some of the things which are not prevalent, so the retrospective case control designs are good, so we can find some of the cases and we can compare with that, okay. Best for the common outcomes, okay, like then relatively inexpensive, because it goes usually retrospectively. So cases are there, you only have to find the control and compare and find the results, but they're expensive because they're longitudinal in nature. You have to have a follow-up period, you have to manage with the sample dropout, and many things are there. Quicker to complete, it takes less time, it is a longer time. They're prone to selection bias, because like once you have the cases, especially for the rare diseases, you have to accept that, okay, and you wanted to have a control, similar control. So selection bias will always be there. What is selection bias? You are selecting the study case and control or study subject by becoming a biased. You are not given a fair chance of selection to the population. then prone to attrition bias, dropouts. Attrition means dropout because the study will go for a longer time, so there will be a dropout. Smaller number is required. Here you need a large number of samples. They're prone to recall, whenever you go for retrospective studies, outcome is there, you wanted to relate this outcome with the past. So it is based on the memory. So that may create a retrospective bias. Whereas prone to bias change over the time in a methods and other things. This is what we call a cohort effect or cohort bias, because something changed naturally. Like if you see, now the adolescent of this age is entirely different of the adolescent of those who were 10 years or 20 years back, because naturally things get changed. Okay, so that is a cohort effect. So that is about the case and cohort. Next and the last important one is a cross-sectional and longitudinal correlation studies. Okay, so only just 2 or 3 points here. Cross-sectional means the data collection at one point in time. Please remember that data collection is at one point in time, short time period. Okay, it's like just taking one picture. Whereas appropriate for describing the phenomena related to the fixed point of time, like for example point prevalence and all, they are the cross-section studies. This design is suitable when there is a theoretical evidence that variable precede to others. So usually, like when I want to relate and correlate dopamine with the prevalence of, depression, or I just want to relate the attendance in a class with academic performance. So that kind of researches can be done in a cross-sectional manner where data is being collected at one point of time. They are more practical and they are done with a short period of time, so less expensive, and there are chances of sample mortality and attrition will not be there. Sample mortality means dropouts, because if a study go for a longer period of time, many people will drop from the research. Okay, and that we call a sample mortality or attrition. So may produce a confusing results because two variables measure the same time. Yeah, there's another important point. Like in the example which I have given, I just want to study dopamine and depression. No, because both the variables occur side by side. Now one can say low level of dopamine lead to a depression, but another can say because it is depression, that's why the level of dopamine is less. Okay, I'll give you another example like infertility and depression. Now someone can say because the person experiencing infertility, he develop a depression. But there is another meaning of that. Because the person is in depression, that's why he is in infertility. Because if both the variables are very closely related, then there is a considerable confusion ki what is the cause and what is the effect. In this particular case, whether infertility is the cause or depression is the cause. Okay. Now, longitudinal means a design that used to study time-related phenomena where data is collected over a week, month or a years. So please, this kind of classification of correlational is based on the number of points of data collection and the duration of data collection. Okay. The signature for longitudinal study is the multiple point of data collection. If you are observing the same person, like for example, I just want to study the nursing students, development of professionalism among nursing students from first year to fourth year. So I'll observe the BSc Nursing students when they are in first year, then in second year, third year, fourth year. So same student will be observed, or same group of student will be observed for a period of time, 4 years. Okay, so there is a multiple point of time, same phenomena I'll observe, same professionalism I'll observe in a 4 times. Okay, so that's why it is costly, it is time consuming, and if it is going for a longer time, then definitely there is a sample mortality and attrition, high percentage of dropouts. Like suppose you have enrolled a 60 BSc Nursing student in first year and you want to observe them for next 4 years. Now, while making the last data collection 4th year, many students will leave the college. Many of them may not come. Okay, so that's the problem. Demonstrate the trend or change over time and temporal sequencing of phenomena for the establishing causality. There is another thing is that with time, there is a natural changes. It is not because of a specific cause. As I've given example, the adolescent of this era and adolescent of 70s or 80s are different. So that also can add into the problem. So overall, I can say cross-sectional studies are the one where we collect the data at one point of time. It is a short researches. Usually we do, for the phenomena where one point of data collection is enough. Whereas longitudinal researches are those researches where we collect the data at multiple point of time over an extended period of time. And usually longitudinal researches are done for the phenomena that evolve over the period of time. Like, can I study nursing student professionalism in a one case or in a one shot? Answer is no, because professionalism will develop over a period of time. Okay, so that is the thing. Now we'll talk about the various types of longitudinal researches. So primarily there are three types of longitudinal studies I want to discuss here. One is a trend studies. Here we examine the change in a pattern over a time using the different sample. Like for example, if I've taken the 60 BSc Nursing students of first year, okay, then out of the 60, suppose in a first year I have taken a 20 sample, randomly I have taken, and I observed them in a first year. Then again in second year, I will take 20, not the same 20. It is not necessary that same sample which I observed in first year will come for second year, but from the same class. So population will remain same, sample may be changeable, okay. So that's 20. Then again in third year, I'll take another 20, and again in fourth year, I'll take another 20. So maybe the subject, same subject may repeat, or it could be a different sample. So that we call it trend study. So trend study is primarily we conduct to see the things that change over a period of time. Okay. Second type of longitudinal research is a panel study. What it says, you collected data from the same sample repeatedly, identify the individual changes. So here in a trend study, what we check, we just have a purpose of population change. Okay, what changes are there? Like as I'm saying, the adolescent of this era and adolescent of 90s. Okay, so you can conduct a trend studies. No, but trend studies will never tell you who changed or who did not change, because the sample are different. Population is the same. So the problem is solved in the panel study. What panel says? You will take a same 20 first year, same 20 second year, same subject, same subject. So every time the same sample you will take for your data collection. So that we call a panel study. So panel study has an advantage over the trend study, and that is because panel will tell you more precisely how much change is attributed. Otherwise, these 20 can have a different opinion than the next 20. So population variability is always there. We cannot deny this. But here the sample you have taken, same sample. Suppose the sample 1 who is observing from first year to fourth year, every time how much amount or how much change we can see in that is a quite measurable with this. But the problem with the panel study is that again attribution bias, because it's very difficult to take same sample every time, so dropout would be very high in a panel study. What is a follow-up study? It is just a panel study only, but similar to panel study, but focus more on specific population. Follow-up study, like for example, I'm just taking a specific group, like for example, those who received a COVID-19 vaccine. Okay, let's say 100 people received the COVID-19 vaccine. I'm just observing them now, maybe after 6 months, after 1 year, after 2 years, and the same subject is observing, but they are not a general population, they are specific population. Or I'm observing a person who receive a new intervention. So that kind of studies are known as a follow-up studies. So that's all about the types of longitudinal study, and with that we complete all different types of correlational studies. So please try to understand, whenever we talk about the non-experimental researches, we always say these are the researches where primarily the purpose is to understand the phenomena in natural setting. Okay, so whether it is a descriptive okay, where the primary purpose is just to describe, or exploratory where we want to explore something, or maybe the comparative where we compare the groups or variables. In a correlational studies, what we do, we just try to correlate the variables. Okay, both the studies, comparative and correlations, are governed with the hypothesis. In a correlation studies, we have a different classification. Maybe the first one is a prospective versus retrospective. Okay, that is based on the when you are going to measure the outcome variable. If your outcome variable is measured in present, it is called a cross-sectional. It is past retrospective, future prospective. Cross-sectional versus longitudinal means, cross-sectional means one time, one shot study. Longitudinal means something that you study over a period of time. Case control versus cohort, already I have told you. Now there is another design, that is a survey and methodological design, that we will discuss in the next class. Thank you.